Monkeypox has been declared a World Health Emergency by the World Health Organization. Dr. Tedros Gebreysus, the Director General of the WHO, claims that more than 16,000 instances of the virus have been discovered in 75 nations, including South Africa. But only 5 people have passed away from monkeypox to date. At least 2 cases were reported in the nation, one being that of a 42-year-old Swiss tourist. Gebreysus noted that in order to track and contain the virus of the outbreak, the Health Organization has provided a list of guidelines for nations to adhere to. Joining us now to elaborate on this development is Peter van Huesden, who is a senior bioinformatician with the South African National Bioinformatics Institute. Peter, thank you so much for your time, and thank you for joining us this morning.
Well, thanks for having me.
Yeah. So we know that the WHO has declared monkeypox a public health emergency of international concern. But I think for a lot of South Africans, the question is what sort of implications usually flow from an alert of this nature made by the organization?
So a public health emergency of international concern is exactly what the name says. It's about international concern. So it's a notification from the WHO that countries should be aware of and respond to a global risk. Okay, so there's actually very little that you're forced to do when the WHO, as a country, when the WHO declares such a PHIC. But what it encourages countries to do is to join in a globally coordinated public health response. So work on diagnostics, vaccines, treatments, and contact tracing, and so on, together, and of course spread information from country to country.
Well, what started out as a small cluster of cases in May has grown exponentially to over 16,000 cases in over 70 countries. You've already mentioned that South Africa is under no obligation to respond in any kind of way to the World Health Organization's alert. But how should South Africans in their own individualized spaces respond? Should we be taking on more precautions when it comes to the virus?
So South Africa has already been responding. So the NICD has already got a testing strategy. But on an individual level, I think one of the issues that has bedeviled this outbreak is that it's happening in mostly in a particular community. Okay, so if we look at how monkeypox normally spreads, monkeypox is normally coming from some kind of an animal to people. So in Central Africa and the Democratic Republic of Congo or the Central African Republic, that typically means people living close to a forest. And it's important to note that this is not monkeys. It was first seen in monkeys, but maybe there's some kind of a rodent or something like that, and people are getting exposed to that and then getting the sickness. And then, in Nigeria, there's been an outbreak going on since 2017, and it's happening in urban areas. But again, we think that it's starting with some kind of a rodent. But what changed things is how it spreads, and I think that's really important to understand in terms of how people individually respond. So the virus and the diseases got into networks of people who are closely connected via skin-to-skin contact. So we've heard that this is mostly spreading amongst men who have sex with men. Most of the cases that have been contact traced thus far appear to be related to sexual encounters between people. And so one of the challenges here is that this is already a community that is stigmatized, that is vulnerable in many ways, and that particular community in South Africa needs to be protected with access to testing and hopefully very soon access to vaccines and treatments. Because at the moment the vaccines which are available are in limited supply and really being snapped up by the global north. It's being made by a single company. They never anticipated this level of demand, and the treatments that are available, well, they're not available in South Africa. So within that particular community that is most vulnerable at the moment, I would urge that everybody works together to alert people what the disease looks like, what the risk factors look like. And of course, we must carry on practicing safe sex, because that is likely to reduce at least some of the incidents of transmission. Not all of it. This is not a solely sexually transmitted disease, but safe sex, it can never hurt, right?
All right, well, Peter, thank you so much for coming on to the program this morning and sharing your insights with us there. That is Peter van Huesden talking to us there about the WHO making that announcement declaring monkeypox a public health emergency.